arthritis in the spine. Now, this is one of those things that's also called wear and tear or disc degeneration or spondylosis. Ultimately, I'm going to explain to you now what it is, what symptoms you may be getting, what it means for you and your health, and what you can do going forwards to improve it. Now, just a bit of a rundown of what it is. So it's basically going to be wear and tear of certain areas in your spine. The discs in between the bones you may find start to degenerate. The height of the disc, rather than being nice and plump, they'll start to degenerate and flatten off. So that will look a little bit more like this, where you can see the space in between the bones is reducing. That can start to press on these nerves. You can get radiculopathies, which is sciatica, down the back of the leg. It can also start to degenerate backwards, directly backwards rather than to the side, and reduce the space of this canal, which is spinal stenosis. That's a little bit more serious. So wear and tear of the discs. You also get osteophytic lipping. So the bones around the spine, you start to get wear and tear through there, and you get something called osteophytic lipping, which is a little lipping or growth around the side of these bones. That happens around here where the discs are, but it also happens at the back here where the facet joints are. Now, these facet joints should sit smoothly together, run nice and smooth, but if that starts to get a little bit worn, you get osteophytic lipping there. That can also impinge and irritate the nerves. So we get the disc degeneration, we get the bone starting to degenerate. Rather than all looking nice and square like this and plump and tall with lots of space for the nerves, it starts to impinge on these nerves. The disc, as it starts to degenerate, rather than looking like this with a nice strong annulus fibrosis and a nice intact nucleus pulposus in the middle, it starts to wear out, and you start to get the nucleus pushing its way through the annulus, starting to press on those nerves, which of course can send pain shooting down the arm, down the legs. Wear and tear in the spine is not necessarily going to be painful. So there's plenty of 80, 90-year-olds who of course have wear and tear but don't have any pain, as well as the fact that there are plenty of people with disc prolapses but no pain. But then there are of course people who have a disc prolapse, a bulging disc, and have lots of back pain. And there are people that have a lot of wear and tear and of course pain that comes with that. But when I'm seeing patients here in the clinic, I don't necessarily go, well, look, you've got wear and tear, there's nothing we can do. Because many people have wear and tear in their spine. They also have back pain or neck pain. But actually, when we start treating them, they get pain-free, because it wasn't necessarily the wear and tear that was causing the pain. It was a contributing factor, but it's other things that could be causing pain, like muscle that's tight, restriction in the spine, a bit of pressure on the nerves. So if we can start to free these things up and move things in the right direction, improve the posture, the alignment, that will make a massive difference to their symptoms, even though of course the wear and tear is still there. If you're young and you want to avoid wear and tear, then this is your spine now, let's say when you're in your teens. You get to 20, 30, it starts to look like this, 40, 50, 60, a little bit like this, 70, maybe 80. Certainly this is heavy wear and tear. This is what you're going to get in the lowest part of the spine or mid-neck, where you get increased stresses and strains in the spine. Other parts of your spine may look a little bit more like this one. But to avoid this kind of wear and tear, you want to keep your posture as good as you can, keep moving well, keep really great movement through your spine with exercise and mobility exercises. It's something that you can certainly avoid or delay, but if you don't look after your spine, you're sat on a computer all day or on your phone all day, and you don't pay much attention to the health of your spine, it will slowly degenerate, and sometimes it crosses that threshold where it's just going to be painful and stiff all the time. If you want more information on spinal health, wear and tear, how to get pain-free with your back pain, your neck pain, headaches, have a look at my channel. I've got loads of other videos. Any questions, pop them down in the comments. I'll reply to you, and good luck with your spines.